This is Frequently Asked Questions about Natural Migraine Relief, Episode 15. Migraine Headaches and Steroid Therapy in the ER, What It Might Mean for You. Hello, Jeff Baker here again as your physician host for Frequently Asked Questions about Natural Migraine Relief for Women. Today I'd like to look at a common tool used to treat acute migraines and how a response to it may tell us something about the cause of that migraine. For years, the use of IV steroid therapy in the ER has been a management option in treating acute migraine headaches. If you have migraines, you have likely encountered an ER visit and possible injectable steroid therapy. A recent study in the journal Neurology asked whether the relative dose of steroid given made a difference in relieving a migraine. And I'd like to take that question a step further and ask if the steroid injection made a difference, why? And what does the response mean about the root causes of a person's migraine headaches? The study from the journal Neurology I mentioned was done at the Department of Emergency Medicine at Montefiore Hospital in New York City. It included 209 patients, of whom 72% were women. From within this group, 34% of them given low-dose dexamethasone achieved sustained headache relief versus 41% improved of those on the higher dose group. The study concluded that the higher steroid doses did not confer significantly greater relief. I would add, at least not enough to merit 4 times the dosage. Acute steroid therapy, like we discussed above, is aimed at reducing inflammation. We know that migraines are both initiated by inflammatory processes as well as producing a post-migraine cascade of inflammation as a result of the headache itself. As noticed in this study, acute ER steroid therapy could significantly reduce pre-headache root cause inflammation, as well as that pushed forward by the migraine itself for slightly more than 1/3 of those patients. A take-home on this would be that if you can break a vicious cycle of inflammation, you might be able to reduce not only the current migraine attack, but also later repetitive headache attacks. Some take-home considerations based on this concept could include: 1, that if you respond positively to ER steroid therapy, it suggests that you have one or more inflammatory root causes promoting your migraines. And number 2, if you don't respond well to ER steroid therapy, it doesn't mean that you have no inflammatory components, but rather that either the other non-inflammatory root cause factors outweigh that of the inflammation and its benefits from steroid therapy, which means we should seek to find out what they are, or the inflammatory drive going on was too great to be relieved by ER steroids of either dose alone. Whether you respond to steroids or not, knowing the root causes of your migraine is essential to developing a plan to manage them. This would be true whether we are looking for either pharmaceutical or non-drug natural therapy options. However, if you do respond to ER steroids, you should look more closely at migraine root factors that are driven by inflammation. In my online course, Natural Migraine Relief, I cover 10 major categories of migraine root causes, including inflammation, each with multiple subcategories. To give you an idea of the variety of potential factors involved, let's review some of these inflammation-provoking categories for you here. Some of the inflammatory factors that might provoke a migraine and may be temporarily improved with steroid therapy could include acute or chronic sinus congestion or infection, reduced methylation of B vitamins, which is a genetically modified factor, and its associated inflammation. Keep in mind that up to 30% of Americans have some degree of this genetic expression. Then there's excess histamine production or reduced histamine management capability. This can be aggravated by food or airborne allergies. There's excess prostaglandin production, particularly if your migraines happen just before or at the onset of your monthly period. There's also provocation of endothelial hyperactivity, otherwise known as irritation of blood vessel lining, which can be provoked by specific foods, smoking, or an excess of prostaglandins, as mentioned above. Also, viral infections, especially those that are pro-inflammatory, like COVID, RSV, or influenza. Another pro-inflammatory factor can be food sensitivities and associated gut flora imbalance, which should be remembered to be a different problem than most food triggers. Some extreme examples of this are Crohn's disease and ulcerative colitis, which can overlap with migraines. Then there are multiple inflammatory factors provoking the trigeminovascular pathway, which are the nerves affecting sensory information from the facial area. It's interesting to also note that excess iron stores can also provoke inflammation. And then there's multiple causes of dry eyes that can have a provocative inflammatory influence as migraine root cause factors as well. If you have any of these issues, management specific to the root causes can lower the cumulative inflammatory results that drive your migraine headaches. For class members, you may remember that these issues are covered in detail in lessons 7 and 8 of the Natural Migraine Relief course, along with the specific therapy options outlined for you in the Migraine Action Plan portion of the course. Among the 26 lessons in Natural Migraine Relief, we review in detail the other 9 major root cause factors for migraine, besides inflammation, that are also keys to making this online course work for you. To review the course content details, see www.naturalmigrainerelief.online. Thanks for joining me today, and I'll be back soon with fresh perspectives, questions, and answers about natural migraine relief.